their highlights if you want to. You don't have to, but you can. And for those folks that weren't able to attend the conference, I guess we just give you an opportunity to hear about the conference if you weren't able to attend. Now, we've got Rachel and one call in. So the person that's on the phone, who's on the phone? Either they didn't hear me or they're doing what I do, which is scrambling to find the unmute button on the phone so they can actually talk. That sounds very familiar. But we also have Rachel and Darcy on the line. So if you have comments, feel free to chime in. Other than that, Christy, you got anything you want to add to the intro?
Yeah.
No?
Well, yeah. So,
yeah, she does. Okay.
Yeah. First of all, we're sharing this, but I'm like across the office. So what I'm going to do is, as I push my head in here about 1,000 times, I'm going to just stop this video from sharing because I look like this headless monster that just keeps coming in. So we're going to stop sharing that video so that you guys can focus on the conversation that we're going to have. So like he said, every year we like to present these highlights from our 2018 conference. We did this last year for the 2017 conference. I just hesitated, as I said, 2018, because I'm in the process of working on making some plans for 2019. And earlier in a meeting, I think Steve's online, he can attest that I actually almost skipped 2019 because I went all the way to 2020. So I'm not sure what year it is, but we're going to talk about what just happened in November at the conference and kind of give you guys an overview of what we had there and some of the key highlights. But if there's people that are on the line that were presenters, we would love to hear some of your take on your presentations as well. Specifically, I know that Susan Schmitz was signed up for this webinar, as was Dave Reddick. Both of them were presenters. So when we get to your presentation, feel free to speak up if you have the ability to do that. That being said, I know not all of you have microphones on your computers. So I think we can just get into it. If we can make it go forward. Uh-oh. Your computer. Oh, there it is.
I don't know why it's doing that. But oh well.
So here's a little kind of a clip of the agenda that we had in November, and for those of you who are there, you've seen this 1,000 times, and I'm sure you've studied it, at least the breakouts, studied it to figure out which one you were going to go to. So we put it in the format of having a pre-conference session. That was an optional workshop day, and then we jumped into this agenda, and we had some general sessions and some breakout sessions so that we could make sure that people got an opportunity to hear what they wanted to hear and get what they wanted to get out of the conference in general. So we're going to probably do a little bit of an overview of most of these sessions. Some of the breakouts might get skipped, but if something that you're looking at here, this was day 2, so this was 2 days, and again, we had a mix of general sessions and breakout sessions. And if there's a session that you are seeing here right now and you weren't at the conference and you want to hear more about it, please go ahead and stop us or put it in the comments and let us know. We'd be happy to look into it. If we weren't there, maybe there's somebody else on the line that could summarize what they heard. So this is just kind of an informal sharing for us to be able to show those of you that weren't able to be at the conference what was there, and those of you that were able to be at the conference, you know, to provide some feedback on on what you liked and what you didn't like and what you want to see in 2019. First thing we want to do is thank the sponsors, because the sponsors definitely help pay for us to be able to do what we do and provide the great lunches and the great snacks that we provide and everything in between. So these were the sponsors that we had this year. We got to see some really, really cool products too.
So these are kind of our highlights from the agenda. These are the things that Chrissy and I thought, well, here are my big takeaways from the conference in terms of conversations we had, sessions that were popular and that kind of stuff. So the first thing, that the first bullet says national efforts to plug gaps. This is based on the Assistant Secretary for Preparedness and Response opened our conference, the ASPR, Dr. Cadlick. And he talked a bit, and we'll get a little more detail in a little bit here about one of his first efforts as the ASPR is to kind of look at where we've been over the last 15, 20 years. And then, so what are the gaps that still are big and need to be plugged? So he's got a couple of projects related to that he's already funded, and we'll talk about those in a little more detail. The second item, Cece Blondio from CMS spoke again about what they're doing with CMS, and they're actually they have a year's worth of data from the CMS survey, so now they're starting to do some analysis on that and come to some conclusions about what's happening, where it's happening, the fact that long-term cares have by far and away the largest number of infractions, but now they're doing some analysis on considering there are so many of them, is that really that many infractions? And so they're doing some putting some good thought into what the data is telling them. Starting to see research in preparedness. In case you're not familiar with it, one of the standing committees of AHEPP is a research committee. And one of the things we're trying to do is put together a research agenda for the organization. And we have a lot of knowledge in the field, but a lot of that knowledge is based on what we consider best practices or experience. And I think one of the ways that we advance the field and one of the ways we advance the profession is to get some solid research behind it and show this works, this saves lives, this saves dollars, this saves all kinds of stuff. So we're antsy to get some more research that's really relevant to people in the field and helps people in the field make the case for what they're doing to their administrations, to their funders, all kinds of things. Pediatrics, you want to talk about that one real quick? That's about,
mm-hmm.
Go ahead.
Yeah, so the pediatrics and preparedness, I think, of course, the general takeaway that everybody wants to share is that it's underserved. We're not doing enough for pediatrics. We don't have enough pediatric beds or resources if there was an event that truly affected the children of this country. But there, on the flip side, and the good news is that there's some really passionate people out there that are doing some really good things. And so we did hear from a few pediatric preparedness presenters that they are working through those problems within reunification and working through a pediatric surge on a hospital and doing exercises, and there's a lot of amazing things that are happening within pediatrics, even though we do know that in general it's been neglected for a while. Planning and exercise is as always continues to be a major component of preparedness. So it's something that is not only a major component, but it's of great interest to most professionals that are working in this field. There was a lot of interest in the making the case presentation, making the business case for preparedness. I think that I hear time and time again that people's leadership are not supporting. We have problems being able to convince people that we need this or that or money for this or that in their facilities. And so making the case or making a business case for the preparedness part of the hospital is a really important topic, and it's of great interest. And we got to hear from some folks that are doing some good things that are kind of putting some numbers to it. And then, as I'm sure all of you know, acts of violence are still, unfortunately, a big concern within the field. And we continue to have lessons learned because we continue to have the response that's needed.
We did 3 pre-cons this year. We usually do 2. The one on the far right, Emergency Preparedness 101 for healthcare facilities, is a standard that we put on. And we really did ask Dave Wallace and Elizabeth Williams to design this around and for newbies, people who are new to the field. You know, they spell out the acronyms that we all throw around like candy. They do a good job of this, and that's a pretty popular session every year. But that's really what that's designed for. And then, as Chrissy was just talking about, people that are interested in selling to the leadership and making the case for preparedness, that was handled by Phil Chaffee. You know, we've been doing this for a number of years, and his session was one where I had people come up to me during the breaks while the session was going on and saying, "This is amazing. He's doing a great job. Please bring him back." I've never had that happen before. So that was Phil, who did a great job, and Steve, who's on the line, I think actually helped us facilitate getting that done. So thank you, Steve, for that. That was a wonderfully popular session, and we're gonna certainly talk to Philip about whether he can help us out in 2019. Now I'm confused. All right. And then we got requests to do some information on full-scale exercises versus facilities, especially in long-term cares that are now have to do full-scale exercises and really don't even understand what a full scale is as opposed to other types of exercises. We designed this for people that are kind of new to the field, but boy, we had people from all over the map in that room. Some of them had been doing it longer than us, although there aren't a lot of people that are doing it longer than us, but me anyway. Chrissy's very young, but I'm not so much.
Oh, nobody calls me that anymore. They used to call me very young, not anymore.
Not anymore? All right, good to know. I'll knock that off then. So both of us are old now, and it was a good session, but we had a lot of really experienced people in there, and we got a lot out of it as well as them. And I think some of my takeaways from that is that as much as we do exercises and as much as we think we know how to do exercises, everybody in that room learned from everybody else. So I think that networking needs to continue, even in this kind of subfield of preparedness. I learned a lot from the people that were in the room, and I hope they learned something from us. This is what we really talked about. We've done, we used to have a multi-day session where we would do exercises from A to Z. I mean, we talk about all of them, the workshops and the tabletops and the functionals and the full scales. And this is kind of the map that we laid out in terms of the components of the different types of exercises. And this session was really just on that right side, on the operations-based exercises, and really only one operations-based exercise. We talked about full scales. We didn't even talk about functionals, really.
No.
So it was a good session. When we started talking about things like the HC template, we had some good conversation about, who's using that and who's not using that. Is that still relevant? And after action reports and all that stuff. So good session, lots of shared information. And I don't know if Christy had any takeaways other than what I got out of it or not.
Oh, there were a ton of takeaways, but I don't want to toot our own horn and spend a ton of time on our pre-conference session, but it was fun to do, and it's as always. We always say, oh, this session is very specific. We want people that are new to exercise to come to this session, and inevitably, all of a sudden, we have people that are very experienced and very seasoned at the topic at hand. And those people learn, I think, just as much as the new people, because they are, helping the person next to them learn something, and all of a sudden out comes some new information that they didn't realize they didn't know, or there's some new ideas. And so even when we get a mix of people in a class like this that is really intended for beginners, those seasoned and experienced people are helping with the class, of course, sharing their ideas, but also still learning because of the questions that continue to get asked by some of the new people. So it's good to mix some of our inexperienced and experienced people up, and these full day pre-conference sessions, not just ours, but all three of them, are a great opportunity to kind of jumpstart your networking within the conference. And I think that that's a theme across the entire conference is network, network, network. Get to know your neighbors, figure out who can do what to help you and what you can do to help those that are sitting around you, because that's what disaster preparedness is. So, all of these pre-conference sessions are kind of just a jump start to getting your networking going, and you get an opportunity to really know somebody because you sit in that same room for a solid 6 hours rather than just an hour and then rotate, and an hour and then rotate again. So it's a good opportunity to work with some new people from across the country.
So Cadlick, Dr. Cadlick, I should say, talked about numerous things at the conference, and it was a good presentation. He is very interesting, and I think so. I've been very impressed with him so far. We gave him an hour to speak, and we sometimes ask people to do things that we think they'll probably say no, but we'll ask anyway. But Christy actually asked if Dr. Cadlick could leave at least how much time?
20 minutes.
20. If he would leave 20 minutes for Q&A, which for Fed to stand up front and give 20 minutes of unscripted time to a bunch of folks like us, that's a big risk. And he did it with bells on, and he was fantastic. I was really impressed that he would even do that. And then the questions that he got were, of course, very specific because these are all AHEPP members. But it's also did a great job of answering them and didn't shy away from hardly anything. He answered them. I was impressed.
Yep, he was pretty straightforward with the entire crowd.
Yeah, he took so his priorities are listed here. The strong leadership. Regional disaster health response system, which I'll come back to in a minute. Public health security is a big issue for him, and then medical countermeasures enterprise is a big issue for him. In case you weren't familiar, the ASPR and HHS has taken the Strategic National Stockpile back from the Centers for Disease Control. That is now housed back within the ASPR. That's where it started, and then it went to CDC, and now it's back with the ASPR. So he's moving on some things that are controversial, honestly. Like it or not, that's what he's done. And that's where the stockpile is now. Public health security and capacity is a big issue for him. They're actually doing some funding through the ASPR and through that agency in terms of medical countermeasures and vaccines and, how do we quickly ramp up vaccine production and do some things like that that he's identified as gaps, so he's putting his money where his mouth is. And then the regional disaster health response system. What he did was he put out an RFA to fund 2 groups to kind of do some pilot testing of regional disaster health response systems. And what that is what he's identified a number of gaps. For example, he thinks there are planning policy issues in healthcare response. And I think he's right. There are always going to be gaps, but what he's looking for is, okay, what are they? And then how do we plug them? So that's a part of this regional disaster health response system. Same thing with capability 4, which is situational awareness. He's concerned about situational awareness in disaster response, especially at the healthcare facility level, and then all of those steps between healthcare facilities, direct healthcare facilities that are actually treating patients, all the way up to the ASPR. Where are the gaps in information? How are we communicating with each other? Do we need to communicate with each other? What do we need to communicate with each other? So one of the components he has in this regional disaster health response system is essential elements of information. What information needs to be passed back and forth, what essential information has to be passed back and forth, and how do we do that? So the regional disaster health response system is a really interesting project. Two funded in the United States. One is Mass General, which is affiliated with Harvard, and in Boston, and treated, is it a majority of the patients after the bombing of the, treated the majority of the patients after the bombing at the Boston Marathon. And then the other one is the University of Nebraska Medical Center, who treated, and the Nebraska Medicine, who treated a number of Ebola patients. So those are the two groups that are working on this project.
Okay, so we had CC Belandio at the 2017 conference and decided that we would like to bring her back to 2018 because a year later we wanted to know what happened after you got these rules out there in the real world. And so I had asked CC what she thought of that and if she would be able to give us an update on what the surveys were saying. And really she wasn't able to, by the time that we had the conference, she didn't have the data, but I was pleasantly surprised to hear that as they started their surveys in November, they started documenting everything that was coming out of those surveys. And within those surveys, people were trying to figure out, what is it that we're falling down on, and CMS is not necessarily, putting down their hammer and saying this is how it should be, and we're just going to fine you. They really are trying to work with those that are having trouble, meeting those guidelines, and they're also working on the trend analysis of the data. And ASPR and CMS are working together. I think ASPR Tracy is working together on that, and it is going. They're actually putting some data together to help people within that world to help them be compliant with CMS.
We have a couple
what you
of
trying to
questions
do?
on chat.
Oh, okay. Let's see here.
Oh, it just popped up.
Okay.
Okay.
I guess we have some.
Oh, sharing the survey results of the conference.
Oh, okay. Survey results. I guess I don't have that as a prepared slide right now, but we can share the survey results. I don't know if I can do it instantaneously within this webinar, but I'll definitely be able to have the ability to share some of the results from the survey. Which survey are you referring to? Are you referring to a survey that CC actually
Oh, yeah, the CMS survey results?
did, or are you talking about the evaluation, like after the conference? Evaluation.
Awesome.
Okay. All right. So now where are we at here? How do I get this to go again? Here we go. So she, like she told us, she's got this analysis of the EP rule going. She is planning on to creating this baseline. I think that she has some of this put together now and was able to release it since the conference. But the purpose of them doing that was to not only find where people were falling down most, but also find where what types of facilities were having trouble meeting those guidelines, and trying to find if there's a regional aspect of people not being able to meet those guidelines. So if those guidelines were maybe not really applicable to a certain part of the country, for example, I think that they just really are working hard to make sure that this rule specifically is helping people do what they need to do better and not just creating an ability to find people. So which I think is kudos to CMS. I mean, they haven't always in the past worked that way. So I think it's great that they're taking note and really trying to do the best thing for this. So she gave a lot more detail to this presentation than I could ever, give it justice to. So I'm not even going to try. But I'd love to hear feedback from people as to whether or not they've had enough of CMS, or if they want to continue to hear more about CMS in the future and where we're going with CMS. So I'd say that my opinion, take it or leave it, is that, if things continue to change or alter, or if there's updates, we would love to keep having her back. She's a very responsive person. She wants to do the right thing. So I think that, she's not just a fed out there telling you what to do. She has some things to help with. But, if she doesn't have new information, we probably need to make sure that we continue to help people learn new things. So emergency preparedness, not just a go kit, was one of our breakout sessions. That was by Susan Schmitz and Donna Hubby.
And Griffin.
And Griffin, except for I don't think she was there.
Yeah.
But I think she helped. She helped put that together. I know it's hard to see.
Yeah, it's hard to see.
But essentially, they were talking about it's not just your go bag and you run to fight your disaster and that's it. They talked a lot about coping and relationships and how to handle that aspect of responding to a disaster. So these were some of the personal coping skills that they recommended. They also had some organizational interventions. They were really into team process and multidisciplinary healthcare teams, which we all know, kind of preaching to the choir here that, preparedness is not just your emergency management person and that's it. There should be many people within that team that's working on that. So there should be a multi-component interventions within these responses as well. So again, this was a lot about personal psychological preparedness and coping with that stress appropriately, and gave some skills and some tips on that. This was another breakout session. Barclay Friends Senior Living Facility fire, the response and evacuation of this facility. So this was by, hang on, I'll get it, Mark Ross. And he's the Vice President of Emergency Preparedness at the Hospital and Health System Association of Pennsylvania. So he spoke about the key takeaways of that fire being more triage and mass casualty training and involving EMS in hospitals. Develop those relationships now. Don't wait for something to happen before you develop those relationships. The online NIMS training isn't enough. And that you should practice. And that's been my experience as well. So, I mean, I think that when it comes to NIMS, it's that online training really means nothing until you actually get an opportunity to practice it in real life. So we run into that here in Nebraska quite often.
Yeah, I was kind of interested in the NIMS training. I think a lot of us knew, those of us that have been around the block a couple of times knew about that. The relationships now, we say that all the time. Practice, we say it all the time. It was the takeaway that kind of surprised me was the triage and mass casualty training and involving the EMS and hospitals, which was good to hear from a long-term care facility that they're starting to talk about that collaboration. And I'm sure they're involved in the coalitions, but I was glad to hear that level of specificity in that one.
Mm-hmm. So care team training in high-risk environments was presented by David Reisman from
Oh.
Mass General. Sorry, I have an old agenda. He was actually a change in presenters because the original presenters got hung up in a disaster response. So Dave Reisman came and presented on the high risk environments care team training. He has been doing a lot of work within NETEC. For those of you that don't know what NETEC is, it's the National Ebola Training and Education Center. And so they've been working on collaborating with the EMS and doing more exercises and developing some of the requirements for EMS to support the waste management and donning and doffing of PPE and some of those very specific things to high risk transport. This is just one of the slides that he had in his presentation. They've been working through how they should really go through their layout of their ambulance bays and how it all works.
Just that patient flow.
Yes, people. Thank you.
Sorry.
You could tell I could not find that word. So that's something that I think a lot of places have thought through since the scare of Ebola, but it's a nice reminder to continue to look at that. This is one of the resources that he highlighted within his presentation. For those of you that aren't aware of what NETEC is, it is a free resource out there online. So netec.org, go to that website and look around. There's a ton of information in there to share. There's videos on how to don and doff the PPE and everything in between that you probably didn't even think of that you would need in a high-risk environment. So it's a good resource, and it's free, and we all like free resources. So, the future of, let's see, this one was another presentation on one of our, I didn't put the title on this one.
No, this one's not a part of NETEC. No.
Nope, it's not.
Right here. Pediatric.
Oh, yeah, it was the PD. Oh, okay, so this was the reunification, the perfect EM buzzword. So now it's a different one
Wrong
too.
way. Sorry.
So now I just let Keith have control of the slideshow. That's a problem.
I can't find it.
So
That's a problem.
So basically within reunification, this was presented by Rebecca Hoffner at Intermountain Primary Children's Hospital. She had some takeaways was that within reunification and the topic of reunification, you need to do some more tabletops, you need to do some more full-scale exercises. Reunification is not an easy process to complete, especially when it involves pediatric patients. Definitely community-based exercises and education, and then possible revision of some of the forms and plans to address some of the specific specificities to children. Is this button working now? Cool. So this slide is from Building Responder Peer-to-Peer Resiliency, was presented by Denise Fulling. She's a research director at University of Nebraska Public Policy Center. And this is just one of her takeaways. And she talked through how emotional reactions aren't always the problem. So people say, oh, people don't necessarily panic during a disaster, but sometimes their coping with their reactions is the problem. And so she had a lot of information on the work that she's doing within that world and how to cope with the stress and emotions that encompass a disaster.
Good.
Mm-hmm. Drilling down on the CMS rule, this was by Dave Reddick's group. Dave, you're online, right? I'm happy to give you a couple of minutes to talk about your presentation. If you What? We'll unmute you. There we go.
There we go.
You're
There. Thanks very much. I'll take just a moment. We had a larger crowd than we had expected, which was happy news, and a lot of specific questions. I was very pleased to get those questions, and I think your membership is still very interested in compliance with the CMS emergency rule. So I was happy to be there to help provide some of that information.
That's good to know. That's good. I mean, I think one of the things that all of us in the field run into a lot is that, we've been talking about ICS for 10 years, so we're sick and not everybody is. That's good perspective, Dave. It's good to hear that while we may have heard plenty about CMS and might be kind of, for lack of a better phrase, over it, that's not necessarily the case for everybody. So good insight. Thank you.
Yeah, we kind of thought that
slides in here. I don't know if you want to talk about your key takeaways.
Well, I'll let you do that. It's just we still have a long way to go, we think, and the trainings still need to be taking place, and we think that training is one of the hardest things to do. But we heard from Cece that they're working to provide some clarity on the audits, and I was really hopeful that we would know more about what the shortcomings were, but as she said, they just haven't gathered that yet. So I'm looking forward to hearing from them. I guess the main takeaway is that we think as a result of the CMS emergency rule, people are safer and better protected. And in a recent call, I mentioned that soon after our conference there was the camp fire in California. And I know that one hospital was severely damaged, and I believe 2 long-term care facilities had to be evacuated. So I'm very eager to hear how those evacuations went. And I would love to think that some exercises that have been conducted previously help them evacuate their guests or patients quickly and staff. So I think that the whole process is one that's going to make healthcare providers safer for their staff and their patients. Yeah,
excellent. Yeah, we're on it. That's one of our upcoming webinars. We're working on finding those people.
Great.
These were some of. So this is from the presentation. I'm moving on to one of the breakouts. This was from the breakout that was presented by Sheen Brenneman and Audrey Mazurek at Asper Tracy. And Asper Tracy has developed a ton of resources. And I think we're just so lucky to have them and what they're working on. And some of the things that I was specifically surprised to see when I was in the presentation was some of these behind the response experiences from the field papers. They're going to people and interviewing. They're taking the time and an expert interviewer to go and talk to these people after an event and pull out some of the things that they maybe didn't even realize that they had challenges with and or had lessons learned for. So that's one of the things that they've started doing, and I think it's really cool, and I think it's one of those things that we can learn a lot from these resources. And again, Asper Tracy is funded by Asper completely, and so everything that they do is free. And so it's great to have a resource that you can just jump on and you don't have to pay for it, and they are so gracious and happy to help with anything that you run into. And anytime you shoot a question to them, they are quick to respond and very helpful. Dr. Fulton, I feel like I've been talking a lot.
It's all right.
Okay.
Don't bother me.
Tired of listening to me. So Dr. Fulton is from, help me say the hospital's name. How did you say it?
It's a hospital in New York. There you go.
Maimonides? I don't
Something
know.
like that.
He tried to teach us over dinner how to say that. Clearly it didn't work. So, but he works in New York City at his hospital, but is also part of the New York City Pediatric Disaster Coalition and a national pediatric disaster coalition. So the New York City Pediatric Disaster Coalition was established in 2008. And it began with some grant money, and they were working on pediatric and specialty hospitals, but then working with some of the other community health providers in EMS and emergency management, and the Department of Health and Mental Hygiene. So they worked together to on this coalition, and then worked to make sure that the other hospitals within New York City, because they all knew that the pediatric hospitals in New York City were ready for a pediatric event. It's just that the other hospitals in New York City didn't know what they didn't know. And so they really worked hard to do exercises and provide some information to those people through the route of a planning and exercise toolkit. And this toolkit is also online, and it is on their website, which was, I think, also linked from our resources page on our website. They actually have completely shared their entire toolkit, which includes exercises that are already developed, tabletops, full scales, all the documentation. Basically, you can take all their stuff and run an exercise with all of their resources. So really cool, really great resource. And I love that this comes out of this conference. Every year, it seems that we find more and more stuff going on across the country that we didn't realize was going on. And people are gracious and happy to share all the things that they've worked so hard on.
We had a really great talk with the presenter, and we've been on the phone with him and some of his compatriots since then, and AHEPP will continue to work with this national pediatric disaster response group well into the future, and we're just having conversations about exactly how we're going to do that. We think that we agree that that's a gap, and I think it's a space that we can help in, so we'll continue to do that.
I'm not sure if this is the last one on my list or not, but this did happen to be the last presentation of the conference. Last but definitely not least, Christopher Lake, from the Nevada Hospital Association, and Karen Donahue from Desert Springs Hospital spoke about reflections from the Las Vegas shooting. Her hospital took on a bunch of unexpected patients. Why were they unexpected? Because her hospital was a trauma center. So she didn't expect that any mass surge of patients would ever come to their facility because they're not a trauma center. And the reason that all of those people came, even though they weren't equipped to handle that, is because they looked at their iPhones and they typed in Google or in their maps, nearest hospitals near me, and that was the hospital that came up. They just so happened to be the hospital that was closest to that event happening. And I don't think it was by much, but I think there was a trauma hospital that was quite nearby them. But when you type in, hospital closest to me, and you're in a trauma situation like that, you're going to just go where your phone tells you to go. So some of the observations, and oh my gosh, I have written pages and pages and pages of notes because I've actually heard her speak 3 times now. And each time I take pages of notes from her. But, she really focused on the fact that they needed to focus on throughput and not surge capacity, because those patients, they didn't have the capability to have those patients stay. They needed to stabilize and get them somewhere else. And that was what they had to do, and that's what they did. But that is something that they needed. They needed to do better and needed to know how to do better. I mean, they did a fabulous job at it. And but it's not something that was was on their radar prior to this. The non-traditional transportation, she said a majority of those patients did not come in an ambulance. They came in anything from their own personal vehicles to walking in straight from the street to in the bed of a stolen pickup truck
Stolen cop car?
to a stolen police or a police car, which actually gave them some security concerns because they actually thought the police were there, but they weren't. The car was there because it was a stolen car. So then they weren't sure, if that was a security risk or what. And then by the time they all got done they thought they were getting close to the near end of their response, an entire bus came with more patients to their door. So the non-traditional transportation was something that they really kind of surprised them. Relationships and not policies. She really focused on that, like that you need to know people, because there were phone calls that she got to her personal cell phone that she would have never picked up if she didn't know those people, because then it would have come in as an unknown number and she would have never answered. But because it was listed in her phone and she had already met that person and had a name associated with it, she saw, oh, that's the director of EMS, I better answer my cell phone. Or, oh, that's the director of this other hospital, I better answer this. They were calling her cell phone and she answered only because she had those prior relationships, and she thinks that's a big priority. Patient registration is a choke point. I think, we've observed this in many exercises in the past as well, but I actually saw her speak in Sioux Falls, South Dakota, not at this conference, but a different one, because clearly we weren't in South Dakota for the national conference. But I did hear her speak there, and there was a patient that was speaking also, and that patient got on stage and started speaking, and apparently she in the meantime called somebody at the hospital to find out if he was listed as a patient at their hospital, and he was not listed as a patient at their hospital. They have no documentation of him ever being registered as a patient at their hospital, but he was a patient at their hospital. So patient registration really kind of stopped and fell down, and that was a big takeaway to me, is that they got some new processes in place. They started writing Jane Doe on people because nobody had their IDs, and so they would do John Doe and Jane Doe, and they realized that they couldn't do that because there were too many Jane Does and John Does, and that was confusing and a problem. So they put a new process together that they are now, their process is for their unknown people or unidentified people, they're naming them like you name hurricanes. So with the ABC,
Adam, Brad, Charlie.
Yeah. Mm-hmm.
Wow.
So that's what they're doing, and that's their process. So some really cool takeaways that came out of such a horrific event. I think we've gone through some of this: incident command, clear text messaging, security, mutual aid. All of these things are important in a response such as this. Lessons to be learned: electronic health records aren't great in those situations. They're not as fast as in just writing, because they have a lot of stop points in electronic health records that are required fields that if you don't have time to finish out those required fields, you just stop. HIPAA was a challenge, just sharing information. Fire and EMS dispatch protocols have since changed in the Las Vegas system, and then the hospital systems working together and how they work together has changed as well. So in summary, for the AHEPP conference, I think,
Oops.
right?
Yep.
I'll let you go.
Okay.
I'm like
Christy's tired of talking. Fortunately, that never happens with me. So I think we had a lot of great speakers. We put a lot of time into selecting speakers, as Steve Ikuda can attest, who's on the line. That's we're pretty serious about that. We don't we're pretty serious about that. We want high quality, not only topics, but we want people who can speak. So we put a lot of time into that application process and selection of speakers. We are also very serious about networking. We build networking opportunities into the conference and actively build those in, so people, whether you want to network or not, we kind of force it at times. So our apologies, I'm sorry, and you're welcome on that, both at the same time. Continued education, we want to foster that. We want to make sure people get the latest and the greatest, and we also want to continue our emphasis to build the research and to put together a research agenda for the field. And we're actually working on AHEPP 2019 and AHEPP, as Christy wrote here, AHEPP 2020, because apparently Christy really wants to skip 2019. Is what is going on here.
Super excited for 2020, I guess.
Oh yeah, Christy will be in 20. I'll be at 2019. I'll be there. If you all want to come, that's great. That's it. And we're back to 2020.
I get overeager.
Oh my gosh.
So if you have any recommendations or comments for what you want to see in 2019, let's stick with 2019 before we go to 2020.
There you go.
Please speak up. Send me a message. My email address is ksanger, KSANGER @ahep.org. Put it in the comments. If you were at last year's conference, or I guess it's this year's conference, and you haven't filled out our evaluation, we'll be reviewing all of the suggestions from the evaluations before we begin creating agendas for the upcoming year. That's what I'm going to start saying, upcoming year. So we do take and consider all of your feedback as we put this all together. And that's why I feel like we have a great conference each year. So
we've just unmuted everyone. So if someone wants to tell us anything or make a suggestion, or you can type it into the text box that we have up, that's fine too. Questions, concerns?
Hey, this is Tobias Watson from Lincoln, Nebraska.
Yeah.
On the evaluations on the YAP app, we were able to download the presentations and materials provided at the conference sessions. There are some of those that are not yet on that. I was wondering if we can contact those presenters to get those materials.
Yeah, I could try to get them. We may not have them for a reason. They may not be willing to share. So you're looking for the actual PowerPoints?
PowerPoints, and there were some tools and forms that were offered during the presentations that have not been made available yet.
Oh,
yeah.
Yeah.
Okay. Yep. We'll look into that. And Tobias, I think you sent me an email. I just haven't gotten around to it because I've been out of town. So I'll try to follow up with those specifics. You sent me the specific people that you are looking for, right?
I did.
Okay. Yep. I'll follow up on that. I apologize. Yeah, I think that there were a few that people weren't gonna share, but we may just not have gotten some of the others. So we just need to follow up.
Thanks for bringing that up. Appreciate it, Tobias.
Not a problem. Thank you.
Anyone else?
Well, thanks for taking your time to join us today and hear what was up at our 2018 conference. And we'll hopefully see all of you at 2019. Have a happy holidays, and we'll see you in January.
All right.